me bring this to more women and make it more well known. Because 1 in 3 women are going to be diagnosed with breast cancer, and it's rising rapidly because cancer is targeting estrogen related organs, and there's a reason for that. It's because we have so much estrogens and xenoestrogens and risk factors right now, toxic burden, obesity, our adipose cells, they secrete estrogens. And when all of that is off balance, then it's affecting everything. It's going to affect your weight. It's going to affect your libido. We're going to talk a little bit about that and how it affects your libido as we get into the topic of the day here. So just that's a little background on me. I've been doing this basically all my life. My son always jokes and he says, "Mom, you don't know anything except medicine." But I also like to say it's kind of who I am, not what I do. So I hope that everyone can benefit from this. This is where you find me. If you haven't already, MarciaJonesMP.com. It is a hormone-focused functional medicine clinic with a primary focus of breast cancer and estrogen-related cancers, because we can change what's happening. 90% of cancers can actually be prevented. That's an astounding number when you think about it, but they can actually be prevented. So functional medicine, if you don't know anything about that, it's lovingly, and I use lovingly because we are talking about love today. It's referred to as root cause medicine. So with that, we dig really deep and look at things from a new perspective, and try to find what's happened that's gotten everything off balance. Because nothing happens overnight, and nothing happens for no reason. If you think about it, there's always some reason something happened. And there's more and more research being done on things like, the GI system and of course, the hormones. And it's not always the hormones that you think it is. Like insulin is more of a contributor than estrogen in some cases to multiple different disease states. So what we do in functional medicine is, it's very patient-centered, and it is digging deep. I have a protocol that I have come up with that I do, that it's identify is the first thing we do, is we identify the cause, and then we protect you from whatever you're going through. And then we get to work and trying to find what's happening. So we rebuild, repair, rebalance, and get you moving in the right direction for total health. So that's all about that. So I'd already asked a few of you, like while we were getting ready to start, what brought you here today? If it's cancer care, cancer prevention, are you a cancer survivor, family member, maybe just curious, or just interest in libido enhancement in general? If that's the case, I think I may have some interesting things for you that you might not have realized. And don't be afraid to pop things in the chat. I have no problem with answering questions. And, while I'm talking, I may not do it, but I do, love to answer questions, and we can talk more at the end of the webinar also if you want. But love, let's just start with it. What is love? I got all these little emojis on here because, it's that whole hearts and flower feeling that everybody thinks about, talks about, but love is also an action. It's a motivator. Like it's this powerful emotion and a connection. So you can think about it in so many different ways, and everybody has a different thought about it. But there's a lot of chemical reactions that happen in the brain and in the body that actually are love. And so when we think about those, we realize after a while that it's actually a blessing and a curse, and how powerful it is, because there are things that are out of our control when we're falling in love. So love has a blessing, as in it makes us feel loved, makes us feel good and happy. And then there's that curse when it borderlines on some of the obsessions, and when we don't make rational decisions when we're going through that love phase. And there's a reason for that. But libido, now this part, that's that desire and the urge. It's the drive. This is a primitive kind of emotion. So that's where I say we don't always have control over it, because libido, you can control your actions, but your libido and that drive, that comes from a lot of different things. If you've ever done any research, like with Freud, I mean, that's been probably long ago in all of our educations. But it's an instinctual type thing, and it's just driven from the subconscious, actually from the id, if you remember that terminology and all those phases. But the chemistry of it is that there is testosterone, dopamine, estrogen, serotonin, norepinephrine, oxytocin. These are all those neurotransmitters and hormones that go into the actual feeling of love. And when we break these down, we see there's the attraction phase. That is when everybody's heart's going pitter patter, and all those endorphins are going on. And you have the dopamine, which is your feel good hormone. You have serotonin, which is another feel good hormone, and then norepinephrine, and that's the one that makes your heart flutter and you get all worked up about things. So that's that new, fresh kind of phase. And you don't always act on it, but it's just that's the part that makes everybody kind of giddy when they start thinking about love. But then there's the lust phase, and this is, the where the testosterone and the estrogen kick in, and this is the part where it starts to get a little, I don't know if you want to say dangerous, but this is the part where people get dumb when they're in love. And you know how like you're the person on the outside of somebody in a new relationship, and you're going, okay, wait a minute. No, you don't want to get married after 6 weeks. And they're like, oh no, I'm in love. He's the best thing ever. What this is because the prefrontal part of your brain literally shuts down with all of these hormones that are being secreted in these neurotransmitters. So when people are making irrational decisions, that is why. And now you have this information that when you start seeing people do that, you can go, let's give it about a year. Because research shows that it takes about a year for that first attraction and lust phase to run its course, and for then you to get into the next phase of things, which is the more comfortable phase. That's the attachment phase. That's where you decide, is this the one that I really want to be with? Is this the one that really I can connect and stick with for the rest of my life, or for a long term? And this has to do with oxytocin and vasopressin. So oxytocin, just to remember that one, is the cuddle hormone. So you think about that, a lot of times there's a lot of oxytocin that's released in pregnancies and after delivery. And so the mamas with their babies, that's that kind of love. So, those are the chemistry pieces of it. And I'm not going to get too deep into some of these. I'm going to tell you, I don't want to bore you, but this is important for why you start to have issues with sexual dysfunction, libido, and maybe even some feelings of love, for self-love and for love of others during breast cancer treatments. So it's all important to this. Now, the mechanics. So this is like that whole functional part of it. So blood flow, you have to have blood flow to the genitals. That's part of the tingle that you get when everything's in those first few phases, and when you're feeling kind of sexy and frisky. That's the blood flow is going where it needs to go. So if you have something that impairs your blood flow, then you're going to start to have some problems with your libido and your sexual function. So those can be things like heart disease. That's usually the big one, and but otherwise, we don't see a lot of blood flow issues with cancer care treatments. That's also more of a male thing, because men, you need blood flow to get an erection. But if you are someone who has trouble with reaching orgasm, or feeling like you can't complete an orgasm, it may be blood flow. And there are a lot of things that you can use and do for that. Some of it is just anti-inflammatories, because if you have inflammation, your blood flow isn't getting out there the way that it should. Sometimes like nitrous oxide, there's a nitric oxide, not nitrous. There is a lot of supplements out now that can increase your blood flow with doing a nitric oxide type supplementation, and that can bring that to the area. There's other things that you can stimulating herbs that you can apply directly to the genitals that will help to increase with blood flow, warmth, and sensation. And I'm sure we have somebody on the call here that could tell us about that today. So the other thing, now, one of the other mechanics of this is lubrication. So you have to be lubricated. I mean, you don't have to. You can still perform, but it's not pleasurable if there's no lubrication. So one of the things that provides lubrication for us as women is estrogen. And so when we start going through breast cancer or treatments, we're blocking hormones, or, it's a hormone imbalance, like I said, that leads to breast cancers. So if you have a problem with your level of your hormones like progesterone and testosterone and your estrogen, then you're not going to have as much lubrication. So if you're in the perimenopausal years, or even if you are under a lot of stress, you release other hormones that are going to decrease your lubrication, because that's the last thing on your brain, if you're under a lot of stress. So there are things that we can do about lubrication so that makes it a little bit more comfortable. And that would also increase pleasure if we increase blood flow and lubrication. Now, nerve function, the thing with nerve function is a lot of times chemotherapy treatments, they will cause nerve damage to the small fiber nerves. So that's I put in here large fiber and small fiber nerves. Some people have sexual dysfunction because of pinched nerves in the back and the nerve roots that come off from the spinal cord. If there's anything that's impairing those, whether you've had a radiation treatment, you have back issues, there's a lot of different things like that that can impact the big nerves that come off of the spinal cord and that innervate into the pelvic region and your sexual organs. That's usually somewhere between the S1 nerve root and below. So a lot of people will have trouble at L5, S1, and down from that level, and that can impair sexual function. So, and like I said, the small fibers from chemotherapy treatments can damage that. One of the other things that can impair nerve function is diabetes, because it stops blood flow and sensation because the blood sugar takes over and impairs those small nerves. All right, that's as medical as I'm going to get. Okay, that was too much. That was a little too intense for all this. So, what are some of the things that block love, though? If we're thinking, all right, where did this love feeling go? Where did it end? Like, why do my partner and I not have all of those same feelings that we used to have? Well, some of it's because of stress. So, stress of everyday life. Stress leads to fatigue. You don't care. Okay. You're like, I just got to get from point A to point B, and that's all that matters. Well, you need to stop and take a breath. And we're going to talk about more of the action items at the end of this. But these are some of those things that can really impair love, the feelings of love. And then you have limitations of time. And now when we start talking about, breast cancer in itself, you may start to have body image issues. If you've had surgeries or you've had mastectomy, or, just not feeling good about yourself in general, maybe you haven't been able to take care of yourself with exercising, or you've let a few things go because you're so into your treatments, and that's okay. You've got to give yourself a break. You have to know that it's okay to do what you need to do when you need to do it. But these are some of the things that just take that feeling away. And then there's self-sabotage. Okay, sometimes, ladies, we get in our heads, and we don't tell the men this, but we do. We get in our own heads, and sometimes we can make things happen up there that aren't really happening at all. And if we stop and think about it rationally, and we align everything up, we can go, oh, okay, well, maybe that wasn't what I really thought that it was. But we're thinkers. We tend to overthink a lot of stuff. And when we start to overthink it, it starts to play tricks with us. So try to be mindful of that. And then we were talking about the nerve damage. Then I did mention the hormone depletion, and sometimes it's privacy. So as you start going, through life, and if you have children, whatever's going on, maybe you and your partner don't have the time that you used to have in the privacy to be alone, to be intimate. And then I kind of had skipped over medications, because a lot of medication side effects just shut it down. They shut down the feeling. There's things like beta blockers, some of your diabetic medications, antidepressants, and we're going to talk about those also a little bit later on as to which ones do what and how you can start to change that a little bit and pay attention to those and set goals to making healthier lifestyle changes that can get you off of some of those medications if appropriate. And then you'll get your libido back. All right. So, but there is more to love than physical connection. So we were talking about sexual dysfunction. We talk about the actions of sex itself, but there is way more to it. You have to feel trust with your partner, safety, connection. You have to be secure, and there has to be some companionship. If you don't like somebody, why do you want to have sex with them? Where's that love coming from if you don't like them? Then if you don't, then it may be just that whole primal primitive libido going on and the lust phase of it. That's okay. Everybody's got their own. Do what you want to do what makes you happy. But if you're not getting, all the feelings that you need to make all that happen, then you're going to be miserable because we need love. It is known, there is study after study that we as human beings need love and we need touch. Even if it's a simple kiss on the cheek, or just a loving touch on the shoulder, or, a hand on your back. Just there's something that just makes you feel loved, and it starts those transmitters and hormones in the brain that we talked about in the beginning to start to secrete that make your heart just feel happy. And so as you're starting to go through breast cancer itself, the diagnosis, it takes over everything. It consumes everything. And you need that connection. You need to know you're loved. You need to know you're safe. And so, that's some of the things to analyze in your relationships, and to think about when you're thinking if you are losing that love connection or maybe some of that feeling of love and libido. But healthy love, I said the research boosts your immune function, improves your mental health, and there is a higher success rate of survival in cancer patients who have a loving relationship. Documents documented, lots of research on that. And it's because you do feel loved and protected, and it decreases your stress levels, which decreases your cortisol levels. There's science behind it, but just know that if you are in a good, healthy, loving relationship, whether it is with a sexual partner or it's, family members that you have that just know that you're loved and supported, you're going to have an increased survival rate. But now, so if breast cancer happens, okay, because that's part of this whole conversation and where we're going with this, your life just stopped, okay? It's okay. You are allowed to feel however you want to feel and do whatever you need to do to get through all of the emotions of breast cancer because it's you, it's your life. Nobody can tell you what to do. Nobody can tell you how to go through it. Nobody can tell you what's right and what's wrong. Nobody can tell you that you're supposed to still be able to have love feeling. You're supposed to be able to function sexually. It's your time, your process. I'm just going to get that one out of the way because I believe everybody goes through processes, and don't ever be upset with yourself if you feel like you're not performing for a partner. You get to be completely selfish. And you get to take time to make sure that you're okay through your entire journey. There's going to be times when you don't want anything to do with it. And there's going to be times when you need it and you crave it. You need that love. So just be okay with yourself and allow yourself the time for what you need through wherever you're going. Because this is mental, physical, and emotional. It is hitting you at every single level, and you don't have to explain it to anyone. Now, you may have a close partner that you feel comfortable with, but just know you don't have to. Well, we talked already that hormone related cancer, and the question always comes up with sex and libido and love is what came first? Your hormones were most likely disrupted first that affected all of this. And now it's snowballed into, out of control. And how do you get it back? How do you get that love back? How do you get that libido back? How do you start to feel that, zest again? It's all a process, and give yourself time to go through the process. So, but the actual impacts, so we're going to go through the documented kind of, scientific things, and the emotional things that go through that impact you along the way. So overall, it's physical and emotional stress that is increasing your cortisol levels. So cortisol is your fight or flight hormone, and it's the one that gets you through all the stressors. And so when that's elevated, it starts to do things to your blood sugar. And when your blood sugar is elevated for a while, you're like in go mode. That's why people in the beginning are in this state of denial or numbness, is because the cortisol comes out and you're just like, you can't even process because other things have taken over. Your fight or flight is kicked in, and you're living and surviving, but the rest of it isn't falling into place yet. But you're still trying to work through. Over here, you just got this diagnosis that shattered your world, that you don't know anything about. You don't know, are you going to survive or you're not? And you start questioning, what are the treatments going to be like? How am I going to respond? So you've got all this going on. But still over here, you've got responsibilities. You've got your relationship. If you've got children, you've still got to get them to school. You've still got a job. You've still got finances you've got to take care of. You've got appointments you've got to go to now. You're trying to like completely realign your entire life. And so the last thing on your mind is love and libido. And then other people, it turns the other way and they may turn to, just having sexual intercourse or, to manage and deal with it. So like I said, everybody has their own things that and you're okay with whatever you do. You're allowed to do what you do and be who you are. But these are the things that are happening all at once that are raising these cortisol levels and they're making all these things happen. So when that cortisol goes up, it blocks your hormone production. So all of those things, the testosterone, the estrogen, the hormones we talked about in the beginning that make the love and libido happen, they're being blocked because when fight or flight happens, your body only wants to survive. And when I'm talking about hormones, you've got adrenal hormones. So those adrenal ones, those are the ones that secrete the cortisol, your aldosterone, and then we go down into your thyroid hormones, and then you get to sex hormones. So hormones are, like I said, not just one thing. It's several different things. So you've got the adrenals that got to kick out, then the thyroid, then the sex hormones. So when you block it at the top, everything below suffers. That's why a lot of times when you're stressed, you start to gain weight, you have cravings, you're tired. All of this is what's going on inside of you. And then, like I said, it blocks the testosterone and the estrogen, progesterone, and all of those other sex hormones because your body doesn't care about having sex when it's in this fight or flight stage. Then, of course, the blood sugar's going up, the insulin levels go up, and you can't sleep. It's one big mess of stress. So then we start into things like chemotherapy. Should you choose chemotherapy as part of your regimen? I'm covering all of these things, whether I know some people do more natural and some people are doing standard traditional treatments, but chemotherapy itself will decrease your testosterone and estrogen. It is a toxin. And when this is happening, this toxin is put in because it is destroying the cancer cells. This is what it is meant to do. So while it is doing that destruction, you have to be mindful of that. And you have to try to make sure that you're doing things to support your body, support your liver, because all of that has to go through the liver. And so does your hormones. Everything is going through that liver one way or another, whether it's to detoxify, whether it's to process and utilize in the medications. All of these things happen in that liver. So making sure that you're very healthy and you're doing things that support and don't add toxins to you, like, try not to do a lot of processed foods and things like that while you're doing chemotherapy. Don't overload the body with sugars because everything is going through that liver and it's fighting for its part and its turn and its pathway to go through there. Chemotherapy is going to disrupt your ovarian function. So that's hormones. And then there's the side effects. You've got fatigue, you've got nausea, you've got nerve damage, and many other things that go along with that, numbness, tingling. Everyone has a different side effect. So all of these things are adding to your stress because it's an extra burden on your body. And I'm not saying that you don't need it, but just know that it's an extra burden and an extra stressor, which is putting you into that chronic state of stress and messing with those cortisol levels. Then if you have radiation, this can also impact the organs and the glands that produce hormones. So depending on where your radiation is, no matter what type of cancer it is, it can affect organs. We've got hormone secretion that comes from the pituitary gland, the thyroid gland, the parathyroid glands. If you're having intra-abdominal radiation therapies done, this is where the kidneys are, the ovaries, your uterus, all these things are happening in there. So that can play a role. And then you have the fact that it can damage and burn your skin and you could be having pain. So if you're in pain, you're not going to be looking to, go out and get a little frisky. You want to manage your pain. And then, of course, body image can be, a part of this also. If you don't want your partner to see your scars or, the redness, you're afraid that they may not, find you as attractive. These are all things when I said we get in our heads, ladies, we got to get out of our heads and stay out of our heads. And you're going to be much better off when you start doing more positive type of thoughts. And, always be mindful of those things, that what could be for real and not real, what we make up in our head and what we don't. And I'm just as guilty of it, so I'm not pointing fingers. So then hormone therapy, I think we've brought this one home for sure. You're going to go through hormone therapy depending on what type of breast cancer you've been diagnosed with. If it's estrogen related, if it's progesterone positive, all of those things go into what type of hormone therapy you may be getting during your treatments. And they're trying to block the estrogen. Well, estrogen, I already told you, that's what has lubrication. That's what makes us feminine. That's what gives us our libido, our drive. And when we take that away, we feel like a shell of ourselves. So there's nothing left. It's just like you're just there going through the motions. But there are things that we can do about this and still keep you safe. And then the estrogen, testosterone that's decreasing, and those decrease change in your sexual function that getting the sensation to the clitoris and to the genital organs, this is impaired by these hormone therapies. Then there's surgery. You can have surgical traumas that impair the reproductive organs, and all the same things. All the same things are happening. Anything that impairs those organs that make the hormones, this is what's happening. And then it's increasing your stress because it's increasing your cortisol levels. Now, how are we going to fix this? This is the part we want to get into, right? Now that we have a better understanding of all the stuff that's going on and happening, let's fix it. Safe. We want safe. So the first we're going to start with is nutrition. You want to make sure that you get good fats. And because this is going to support your natural hormone production and energy. All hormones are made from cholesterol. So this is important that you understand that you want things like avocados and nuts and seeds, salmon, olive oil, avocado oils. All of these things are naturally going to improve your hormone function, and not just the testosterone and the estrogens. There's all the other hormones that are playing a role in this. Your adrenal hormones, your thyroid hormones. You need to have those things. And if you already have high cholesterol and you're on something like a statin, or things that decrease your cholesterol levels, that's a big controversy right now, because one side says drop down the cholesterols to the bottom of the barrel. The other side says, hey, we need this to function. And if you don't have enough of those good omegas in your body and those good cholesterols, you're not going to make your serotonin as well either. And so most everybody who has low cholesterols, or not the appropriate types of cholesterol, you're going to be depressed. So you're going to come into whatever already depressed and having a mood issue because you don't have the nutrition that you need. So make sure you support that by getting all those good fats in there. And then you want to increase your protein. You want to get lean proteins. And this helps for building blocks and repair of the body. So when you're going through your cancer treatments, and I'm talking about all this stress and all this impact that's happening on your body, you've got these mitochondria that are working so hard to take care of everything. They're trying to repair you. So as you're getting chemotherapy, you're going through surgery, your body's fighting to get rid of this cancer. It takes energy. This is a fight. This is an all-on war, and everything needs to be there to make sure that things are happening the way they're supposed to. So when you get good nutrition, you're going to be fighting this good fight, and you're going to have that energy that you need, so that at the end of the night, when you're ready to have that intimate time with your partner, you have a little energy left over. Because if you're only driving on these carbohydrates, and a lot of times it burns me to hear people in cancer treatment going, oh, have milkshakes, eat your ice cream, eat whatever you want, just get those calories in there. That's not true. That is not true at all. There's a difference in food and nutrition. You need nutrition for your body to fight and to survive and thrive through your cancer, and to leave you that energy, like I said, left over at the end of the night, to have time for yourself and intimacy. So make sure that you're utilizing this when you start to do your management of libido and love even. And then stress management. You have to take care of your stressors. I think I've given you plenty of stresses in this to understand that is the biggest fight you're fighting. And stress increases inflammation. Inflammation fuels cancer. Inflammation fuels those blood sugar levels. It's going to raise your blood pressure, and it's going to halt you from all of the things that you want to enjoy. So decreasing that inflammation by making sure you have time to relax. You do yoga, meditation, all of these things factor in. And Jeanette, I'll address that. Okay, honey. We'll talk about that too. So knowing the importance of your mental well-being. Remember, take care of you. There is a time that you have to understand that you cannot take care of anyone else until you take care of yourself. And we are women. We're the caretakers. We're the mother, the wife. We do everything for everyone. And you're still trying to make it all happen and take care of yourself. You're only hurting yourself if you keep doing this. You're not going to thrive. It's going to take you longer to go through your treatments. It's going to take you longer to respond, and you may not respond as well if you are not able to take care of yourself and your own mental health. And you've got to know when to ask for help. There's nothing wrong with asking for help. And we need to learn that. I focus on women primarily for a reason, because I understand how we think and I can help you with those kind of things, because we don't like to ask for help. We do it all. We're the martyrs, right? Stop being a martyr. Allow yourself time for rest and healing. And if your partner isn't understanding of that, then you need to have a conversation. You need to have a really deep dive conversation to work through those kind of things. Now, there are things like, I got on my soapbox there. We can calm that down a little bit. There are things like essential oils that you can use. These aromatherapies, they help you with your stress. They help with desire, relaxation, spontaneity, sensuality. Like, there's certain scents that triggers the brain to put you into a whole different place. So you may want to use this. You can use them in sprays. You can use them in rollers. They're very safe and non-toxic if you put them in things like coconut oil, almond oils, jojoba. Those are all very easy to use. You can get them. You can do, natural. There's a lot of natural products that you can get. Etsy's a great place to get those kind of things. Or you can make your own. You can go to like Michael's or, oh my gosh, what's that other store? Hobby Lobby, those kind of places, and you can get the things that you need to make your own essential oils. They have some that are pre-blended. They have ones that you can make your own to see how you feel with it. What you and your partner like. There's a great place. I know some you've here from Northern Virginia. There's a great little apothecary. Gosh, I can't near Percival. No, anyway, there's a little apothecary, and she makes an oil that is just for arousal. And it's got a lot of these sandalwoods and patchouli in it that increases your the sensuality. And you can actually use them as a lubricant also. So they're safe to use when they're mixed in these certain types of oils. The only thing you have to worry about is that the oils, you can't use those with condoms. So if you're using condoms for safe sex practices, you can't use an oil. You have to use a water-based, or it's going to increase the risk of the condom breaking. But you might want to explore that a little bit and look into that. Gosh, I wish I could remember the name of the place, because you can even get her stuff online. It'll come to me. But so the lubrication, so I said you can use some of these essential oils that you're killing two birds with one stone. So you can use those as lubrication. You can use those to decrease your pain, increase your pleasure. You can get some of the warming oils. You want to be careful with those, because you don't want to burn yourself. But some of the milder warming lotions, as long as they come from a natural herb and resources, go for it. It increases every pleasurable sensation. And coconut oil, primrose oil, these are some of the lubricating oils that you can use, even if you don't use your essential oils to scent those. Those two oils, I mark those up there because of the condom's safety. Aloe vera, you might not think about that, but aloe vera is very safe for use. And it can also help with chafing, any kind of irritation that you may have due to vaginal dryness. And then there's water-based products, organic products. This is what you want to do, and this is where you want to start looking. Now, one of the other things with lubrication is, and I'm going to talk about it in a minute, is because of the estrogen depletion. So if you're not able to use estrogen of any kind, then those are great resources. So then there's supplements that I really like. I like Designs for Health, because the Designs for Health has no toxins added into their products. They're very reputable. What they say is in their product is in their products. They are a company that actually, if they can't make it and make it safe, they don't do it. Their integrity is that high that they aren't just making money off of everything. Like there's a lot of people who ask for things that are in gummy form or, but if they can't do it without sugar, like they don't put a lot of sugar in their products. So if they can't do it the right way, they don't do it at all. So I really like them for that. Kudos to them. But Omega Avail Synergy, this is one of those that has the really good omega ratio that's going to help you with your production of those hormones because it's going to give you that right balance. And it's anti-inflammatory. So it's going to help decrease that inflammation that's happening in the body while you're trying to fight cancer to begin with. But omega, everybody should take omegas. It's going to enhance your mood because it's working on those neurotransmitters also. They get everything to the brain that helps make you happier, gives you more energy, helps you sleep better. Pregnenolone, I love pregnenolone. This is a precursor to the adrenal, thyroid, and sex hormones. So this is one that's going to go down the appropriate pathway. So if you are not in a state of toxic overload where you have the extra estrogens that are turning into the wrong type of estrogens. That's in a different lecture that I did. But as long as you are taking care of yourself in the right way and you are not at risk for these things going down the wrong pathway and you're getting those things checked, you can use pregnenolone safely for about 3 months. And even as long as you're checked off, I recommend a functional medicine provider, of course, because you may not get the right answers elsewhere. But pregnenolone is really good to use for about 3 months very safely if you're completely depleted. If your stress levels are that extreme, we know you have this adrenal fatigue. And adrenal fatigue is an old term, but everybody understands it, so I still use it. Your adrenals are like, I'm done. Like, I'm so stressed out. I can't do this anymore. And when that happens, you don't have any more to give. So this pregnenolone is kind of like giving you a little more gas again. Yes, Jenna, honey, I do have a PDF that of all these slides. So that's going to give you that gas in your fuel tank. So even if you're one of those, it's like, I'm going to try it. I always recommend that you get a good evaluation, but you can try it, just don't do it for more than 3 months without having your levels checked. Okay. But it's going to give you energy. It's best taken in the morning. I like the CRT, and that's the only where I get that is the Designs for Health because it's an extended release. So you take it in the morning and you get that pep in your step and all those good hormones and some energy that goes along with it. If you take it at night, you may not sleep very well. And now, Libido Stem M. This one is fantastic. Okay. This is to enhance your libido. And you're going to think, well, did you make a mistake? Because there's an M and there's an F, a male and a female version. No, I did not make a mistake because we don't want to stimulate estrogen. So if we're in breast cancer and hormone management, we're trying to balance that, how much estrogen you have in your pathway. And until you get the appropriate testing that says what type of hormone you have, don't have, and the advanced hormone testing like we do in functional medicine, you want to be careful. So libido stem, men don't need extra estrogen. So their libido product has DIM in it that is going to help to block the overproduction and aromatization of estrogens. So if it's blocking that, then you're not producing that extra estrogen. You're getting all the other herbs there that help to stimulate libido without damaging yourself. And what I put in parentheses here, this is one of the main ingredients in it. Look that one up when you get chance. If you like to do your research on things, there's actually a lot of research with this supplement and cancer. So we're doing a lot of benefit and getting, so like you can tell I really like this product. We're doing a lot with this one product for libido and for addressing cancer itself. So when you do the research on that, you may like what you see, but that's a good one to look at. And none of these, by the way, work overnight. They're not ones that you take and do just like this. The pregnenolone, it's going to start to kick, I'd say about 7 to 10 days, you start to notice a difference with that alertness in your mood. The libido stem, same thing, is going to take about 2 or 3 weeks, but you need to remember that you've got to address all these other things. You've got to make sure your stress is improved. You want to work towards getting those omegas so that you're able to absorb the libido stem and everything is working correctly. This is all a big, conglomeration. We need everything to be working together in harmony. The adrenal support, this is adrenatone. So remember, those adrenals are just whacked. They're like, I can't take any more. So the adrenatone helps to support those adrenals, which helps to support all those stress hormones and the cortisols. So you can take all these together, or you can take them individually. You can pick and choose between them. So if you're looking at the pregnenolone and go, okay, well, Marcia, you said that was, that precursor, and I don't want to take any chances with the hormones at all, then don't use that one. Use the adrenal support. There's, a lot more details that goes into all of the products, but that's the best way to look at it. I'm very comfortable with prescribing pregnenolone to my ladies for the first couple of months and monitoring their levels and what's going on with those. But that's that advanced testing that I do with it. If it's not something that you're going to, pursue down that route, then maybe you just short term or, skip that one and use the other ones. But those are your options for some really good supplements. And you're going to get an email after this. If you registered for obviously you're registered for it, you're going to get an email that has the link to these for you in case you forget them. And that PDF file is a overview of these slides that we've done today for remembering what we talked about. Vaginal estrogen. This is not hormone replacement therapy. This one, I'm not even going to go down that route into a general lecture like this because there's so many different components to it if you have breast cancer. So vaginal estrogen is safe. That I can tell you without a doubt, without anything else, know anything else about you. Vaginal estrogen is safe. It helps to increase lubrication. It increases sensation. It helps with vaginal dryness that could cause pain, because if you have intercourse with a dry, vaginal canal, it's going to hurt. You're not going to want to do it. And if you're doing it just to appease your partner and you're having pain afterwards, then you're not practicing self-love. We talked about it. You're not practicing self-love and self-care. Stop being the martyr and stop letting everybody else control you. Right now, of all times, if you have breast cancer, you need to take care of you. Be selfish. If no other time in your life, be selfish right now. You're going to benefit from it. But I'm sure you still want the whole intercourse and intimacy, but you do it where you're going to enjoy it too. So any further recommendations, like I said, takes a full hormone advance test and full history. That's it. That's all there is to it. Med review. This one I went a little further because a lot of times you're on anxiety and depression medications. They are serotonin blockers. So they are going to decrease your libido and they are going to decrease your ability to have an orgasm. So you want to look at these very closely. There are things like pharmagaba that work naturally to help to decrease your stress levels and to decrease, all that cortisol business that's going on. And then that adrenatone that we talked about, all that's going to help with your anxiety. And balancing your hormones, all hormones, including the cortisol and the insulin, is going to help you with anxiety and depression. Far too many people are placed on these medications when they really have nobody's ever looked for the underlying cause. And if we treat the underlying cause, you probably don't need these medications. So, but pharmagaba is something that can help very safely with that. Pain medications. If you are going through any treatments, if you're having surgery or having radiation, those types of things, and you're in pain, some of it can be from inflammation. They're going to give you pain medications, and that's going to increase constipation. Constipation is going to increase inflammation. All of this is causing a big cycle, and it's going to decrease your libido. So pain, things you can do for pain is like inflammatone. That is one of the supplements through Designs for Health that really helps to decrease inflammation. This Canab PEA 300. This one does not have any THC in it, but it helps with pain control, helps with inflammation, helps to address a lot of the things that are happening, and it also helps with stress. So it fits into this pain and stress complex that's happening that may be impairing your libido and your energy for a little loving. Let's see what else I got. Movement. You got to move, okay? You got to get that blood flow, and we talked about blood flow. And I don't mean exercise. You don't have to. If you're already tired, you're wore out, I do not advocate that you try to go into some big, exercise program. That's not what you're doing right now. You need just regular physical activity, even if it's getting up and walking around the room, walking to the other side of your house to go to the bathroom, or just going outside for a nice light stroll, feeling the air, get that blood flowing. That right there in itself is going to increase your mood. It's going to give you some feel good. The serotonin is going to be released. All your endorphins are going to be released. Your dopamines, you're going to be happy. And that right there can increase your desire just doing that. Take a walk with your partner, do it together. And that can start to be, a little bit of your aphrodisiac. And this part right here is so very important. You want to be able to communicate with your partner. You want to have support from your partner. You need to have open dialogue and honesty. If something hurts, tell them. If you're not in the mood, tell them. Let them know that you love them. And there's other parts to love than physical love. And once you've gotten through whatever phase that you're in that does not allow physical love, it'll come back. You're going to get it back. Let them know, once you're through cancer treatments, they rip you apart. Okay. They are hard. It's the hardest thing you're probably ever going to do in your life. But on the other side of it, there's hope. Maybe you're going to learn some lessons from this. It'll help you too after you've been through your journey. Because sometimes people are very, very supportive during your cancer journey. And it's like everything in the beginning, everybody's all like those endorphins that we talked about in the beginning of the love phase that kind of start to fade away. When you're first diagnosed, everybody's there for you. Everybody's supporting you. When you look washed out and tired and you're going through your treatments, everybody's there for you. What happens after you ring the bell, or you finished your treatments and you're told, okay, you get your post-cancer treatment now? Where's everybody at? This is the hard part. This is when you're still tired and your body has been ripped apart. It's been through war, and you gotta rebuild it, and you got to put it back together. You've taken all your hormones away. We've stripped you of everything. We've given you these toxic chemotherapy agents that are left inside of you. Now you have to start with the detox. You've got to get the nutrition in. You've got to get your energy back. You've got to put yourself back together and balance everything to where you can have energy. You can have that vitality. You can have that love and libido, and all of it's coming back. So talking to your partner about all of this, staying in tune with yourself and your needs and what's going on. Hopefully I've helped you to understand a lot of it yourself, even a little bit better, that you can put these things together, because it's the whole package. You can't do any of it without all of it. And you have to know yourself and know what's going on with you, and have a partner that can understand. Funny, Gina, I just see your oncologist said no to vaginal estrogen cream. Like, it stays right there. But I won't argue with your oncologist. Alternative therapies, acupuncture, massage, Reiki, yoga. These are some of those other things that you can do for yourself that help you to put your mind at ease and to relax and to, not be so stressed and so tight and so tense. Look into these if you've never explored any of them before. Self-love, I keep talking about that. Compassion for yourself. Understand what you're going through. Like, give yourself some credit for what you're going through. Embody positivity. Get out of your head. Know that you are beautiful, and there is so much more to you than this. This is our exterior. I'm sure many of you know there's a lot of beautiful people on the outside who are really ugly on the inside, that don't get a whole lot of love, because who wants to be near them if they're that miserable and that horrible? So know your value, know your worth, know who you are, and love yourself and take care of yourself. You have to do that. You have to do that. And here's how you get that free download. Like I said, I want to put it in an email for you, but some people will be watching this, after the fact. But this is how you get it. MarshaJonesMP.com at Love, Libido, and Breast Cancer. And you can download that. Most all the slides are on there, the overview of it, and the supplements that we talked about, so you can access that. It'll also, when you get that email, it's how you can message me if you have more questions after this is all over with and something you've thought about later. But that's that. We're almost done. We'll get to questions. This here is the functional medicine wheel. So it helps you to understand all the things that we do, that we put into play in functional medicine, that it's gut health, it's emotional health, detoxification, the relationships, the sleep. It's all of these things. You cannot repair if one piece is broken, the spoke in the wheel is gone. It's an incomplete wheel. It's like having a dent in your rim. It's not gonna get you where you need to go. It's only gonna cause more damage. These are things that you want to look, any further into. This is how we do this. I have free discovery calls. We get 15 minutes where you get to ask me all your questions if you have questions about everything. But that's all that. Okay, question time.